absolute delight to introduce the panel that we have today. So we have Elliot, who is the National Director of Public Policy and Advocacy at St Vincent's Health Australia, Jack, who is the Chief Technology Officer at Triscoe Labs, and Toby, who is the Senior Manager for Digital Health Policy at the Medical Technology Association of Australia. We really want this to be interactive, so take it away, Elliot.
Thanks for having me. St Vincent's was the victim of a cyber attack in December of last year, and I thought I was just going to run through quickly a bit of a précis of what that incident was, but more importantly, how we responded to it and some of the lessons that we've learnt along the way. So on the 19th of December last year, our cyber team, in conjunction with CyberCX, detected some suspicious activity on our network and discovered a threat actor was operating somewhere within the St Vincent's system. From there, it became apparent that some activity had occurred. We activated a series of response mechanisms, and by the morning of the 20th, we were advised that the threat actor was no longer present on our network. And then we had a series of really tough choices because we knew that a threat actor had been on our systems, but we didn't know what they had done. We didn't know if they'd taken anything, and we didn't know if the things that they may or may not have taken were of a sensitive nature. So then we went into a series of effectively quite deep forensic work led by our digital team, our cyber team, and in conjunction with CyberCX, trying to get to the bottom of what had actually happened. But the more important question that we had to ask ourselves was, how are we going to use our values and how are we going to use the mission of St Vincent's in applying that to the response to that incident? And at that stage, we didn't even know what the incident was, but we knew what our values were. And so our CEO and our ELT and our board led a series of quite deep discussions in that first 24-hour period to have a conversation around what value set would we use in first responding to, and then communicating about, and then hopefully addressing the incident itself. And the framework that really we felt was presented to us was a choice about whether we would use our a risk framework or that we would use a trust framework. And for us, what that meant was, would we as an organisation seek to minimise the risk to the organisation, or would we as an organisation seek to improve and build, or at the very least maintain the level of trust that we had as an organisation? And for us, that trust meant with our people, it meant with our patients, our residents, the community at large, government, or number of stakeholders. Or would we just seek to do everything we possibly could to minimise the immediacy of the risk presented by this cyber attack? And so using the values that we had and that we have had for 165 years, we landed that it was more important to us to maintain and build the trust that we had in the community at large than it may have been to necessarily done everything we possibly could to seek to bunker down and minimise risk. So how does that play out in practice? If you're taking a risk-based approach, you want to look for the lowest common denominator in terms of your legal obligations, your public obligations, and your reporting obligations, because you want to, and I'm conscious of how many directors of St Vincent's in the room, but if you want to do that, you put your lawyers in the middle of the response, right? But if you want to build the trust with the organisation, you've got to really put your people and your stakeholders at the heart of what you do. And that was the choice that we made, that we thought it was more important to use this opportunity to build the trust that we had with our people and with the community, even if it meant a shorter term hit and maybe a slightly more risky proposition in terms of some of our reporting requirements. That actually meant being more open, more transparent, more communicative than maybe what we were required to have done at any individual stage. That for us was the critical strategic choice that we made in the first 24 hours. That then led us to a series of threshold questions about when would we go public and what would cause us to go public. We established those. There were 5 criteria that we set for ourselves around the nature of the investigations that rolled on. We met one of those criteria on the Thursday, 2 days after we first detected the suspicious activity. the very next morning at 11 a.m, we went public and confirmed to our people, to the public, to the community at large, what had occurred, what we knew at that stage, and what we were seeking to do about it. And we then went into a very long forensic investigation that continued on every single day between the 19th of December right through to the 25th of January, when our digital team established exactly what had been exfiltrated, stolen from our systems, the nature of that data. We went public with that. We shared that information with people. It was established that there was no sensitive or personal information that had been exfiltrated. It was a series of configuration-only data. And the federal government then put out a response that referred to St Vincent's as the exemplar respondent to a cyber incident. Now, we think that happened for a number of reasons. One is we acknowledge, first and foremost, that we got extremely lucky with the forensics and extremely lucky with the nature of the investigation itself. We were the victim of what's called a pre-ransomware attack. It means that a malicious actor, a threat actor, a cyber criminal was on our system and was about to exfiltrate and steal a large amount of data, but they were disrupted at a certain point in time and they failed to do so. It was a pre-ransomware attack. If they had succeeded, we would have been having a very different conversation. So that was the first part about how we got lucky. The second part is that, for whatever reason, that disruption and the nature of the timing of that meant that they were never able to have an operational impact. They were never able to have any data stolen from us of a sensitive or personal nature. But we operated, and this is the key part, we operated and acted every day as if it was about to happen, or more importantly, that it had happened. And because we operated through that framework of trust, of telling and sharing with people what we knew, even when we didn't know very much, it meant that we were emerged at the other side of the incident with a maintained or increased trust level through that incident. I'm conscious of time, but I'll just make sort of two very quick points and we might pick up some of it in questions as well. There's probably three quick points to make and people can ask questions I want to get to. The first is for a health company thinking about how to respond. The first is you need to understand what sort of crisis you're in when you go through a cyber incident. And our story is common in some places and unique in others. But every incident will probably fall into the bucket of either being a technical incident, an operational incident, but they've all got an element of being a reputational incident. And so understanding exactly which bucket you're sitting in will help determine the sort of settings that you put in place and determine the framework that you put in the centre of your response. The next most important thing is the old adage of know your customer also applies during a cyber incident. You need to know your business. And that means having a thorough understanding of who your stakeholders actually are and how you're connected. So healthcare in the cyber world is probably the most interconnected, interdependent sector. As a consequence, it means we're also we are the most exposed to a cyber incident of any sector as well. But it means that the ordinary stakeholder map that you might pull out of the top drawer and think, who do you need to communicate to and talk to, is just the tip of the iceberg. And that's what we discovered as well, is that the integration you need and the collaboration you need between your digital team and your stakeholder and response team is critical. Because what you will discover is that every single system in your health and aged care businesses are digitally interconnected with almost every other part of the healthcare system, government system, payment system you can imagine. So you can start to think to yourself, well, I know who the Minister for Health is, and I know who the Department of Health is, and okay, if I really think about it, I might need to talk to Medicare and some of those ones. But if you had told me on the 18th of December of how much of my time was going to be spent talking with the junior IT manager from the Toowoomba West Southwest HHS manager, because they have a digital connection touch point with Sydney Pathology, who sends 6 path lab results to Sydney Public once every blue moon, and they have a digital data connection point with us, and therefore we need to be talking to them constantly before we make any public announcement, because we don't want them to pull the plug on us and impact 6 patients, and all of a sudden you've now got 6 pathology results being done by fax down at Sydney Public. I wouldn't have believed you. But our digital team definitely knew that we had a digital connection touch point with Southwest Toowoomba Health Hospital Service, and now so do we, and it's etched in our minds. So the really easy thing that people can be doing right now is having your stakeholder team sit down with your cyber team and just ask a really basic question of who are we connected to? Because you will learn more about your business through your cyber digital touch points than you will in thinking about the very obvious series of government touch points as well. And the final point, which I'll come back to in questions if you can, is how do you determine the cadence of how you communicate and how often you communicate, even when you have nothing to say. So we'll see if we get to a question on that, but thank you so much.
Now we will hear from Jack. Thank you for that perspective. That was really insightful.
Yeah, thanks very much, Elliot. And it was a really good example of these attacks that are happening kind of every day, right? He's gone through some of the big ticket issues you might face if you are experiencing one of these attacks. But to give you a bit of insight from my perspective, being the Chief Technology Officer at Trisco Labs, who is a cybersecurity consultancy, we're dealing with these attacks every day for organisations across Australia, big, large, medium enterprises, right? And so what I'm going to go through today is a bit of a step up, a high-level view of some of the statistics we've derived from these attacks, an insight into what's affecting Australian businesses. So Trisco Labs, what do we do? Cybersecurity, offensive security, defensive security. But the key part that's relevant to today's talk is digital forensics and incident response, right? This is the digital forensics component that Elliot was talking about. So we'll help organisations through these attacks and perform this forensics for them. Worth noting that often this work comes from cyber insurers, right? It's something worth considering for many businesses across Australia, perhaps most in this room, what your cyber insurance policy looks like, if you have one, because the response that you can get under a cyber insurance policy is quite comprehensive. They bring us in sometimes within minutes of recognising an attack. They'll also bring in the other entities you need, whether that is legal, PR, up to things like ransomware negotiators, right? It's quite a broad spectrum of help that you can get in that area. We operate a follow-the-sun model, so we want to make sure when we're responding to an incident, we don't just go to sleep overnight and no work gets done, right? We hand it over to America, who hands over to the UK to make sure that we are continuously working on this, because often these attacks against organisations represent business interruption. You might not be able to service your customers properly. Some of those services might be quite critical, particularly in the medical industry. So a brief overview on the major attacks we're seeing. Right? Elliot already mentioned ransomware, or in his context, right, pre-ransomware. Often, unfortunately, businesses aren't quite so lucky as to catch the attack before it happens. In many cases, a threat actor will get in, compromise a network, but then be able to execute ransomware, which at a high level will lock you out of all the systems that you need to get into. It may interrupt the services you're providing to your customers. They'll also exfiltrate sensitive information, and they'll try to hold you to ransom for this information. So they'll want you to pay them to A, unlock the systems, and B, stop them from releasing this information to the public. It's quite a damaging attack. The second attack that we see that's most prevalent, we call it business email compromise, and this is simply when a threat actor gains access to an email account. They ideally look for a staff member's email account that deals with invoices and payments, and they'll sit there and they'll wait, and then they'll try to jump into the middle of a communication to change BSB and account details on an invoice so that a payment goes to the incorrect party. We see a bunch of others right on this slide here. Websites, insider threat attacks, data theft, etc., etc. But those first two are definitely the predominant attacks. Some statistics. Across the last financial year, we responded to over 100 incidents of this nature. You can see the breakdown there between ransomware, business email compromise, and other types of attacks. It's a pretty even split, with business email compromise being most of them, but a whole lot of ransomware attacks as well, which can be quite damaging to organisations. I've got another slide as well on the industry verticals that have been affected. I mean, it's very small. It could be potentially hard to read. I think the big takeaway from this slide is that there is no one industry that's being affected by these attacks. What we've seen and what's being reported is that the threat actors are looking for what we call low-hanging fruit, right? They're looking for the easiest job that they have that can give them the biggest reward. So the easier the vulnerability is to exploit, the easier for them to get into an organization so that they can compromise it, the more appealing it is to them, regardless of what industry that they're in. Some specific stats around ransomware. How do they actually get in? Well, there's a few things here with some terms that may or may not be recognizable to you, but from this slide, the big takeaway is remote access systems. Certainly during COVID, work from home became a huge part of many of our lives. It certainly became a bigger part than it was previously. So things like VPNs that allow you to get into a work system from home, this has become a prime vector through which threat actors will exploit to gain access to a network, because unfortunately, often these remote access systems don't have the right controls around them to prevent threat actors from getting in. When they do get in, what we see here is that they exfiltrate an average of about 400 gigabytes of information. Now, when I go through these averages, it's worth noting that a lot of the businesses that we're helping out are on the smaller end of the scale. In the news, you might see some huge statistics for the big ticket, the big companies that have been affected by this, right, the Medibanks or St. Vincent. But it's so common that so many of these attacks will affect smaller organizations and it's never reported. So 406 is how much data, 406 gigabytes is how much data we often see being exfiltrated. Sometimes it's a lot more, sometimes it's a lot less. Ransom payments is a very interesting topic that sometimes doesn't get spoken about enough. It certainly does happen. We see it happen about 13% of the time. And ransom payments, it typically only happens if there is absolutely no other choice for the organization. They've been put in a position where if they don't pay this ransom to often what is a Russian threat actor, then their business, it's going to go bust, right? It's going to go into administration. They're not going to be able to pay their bills, service their customers. So ideally, your preparation steps focus on not finding yourself in this situation through preparedness, having incident response plans, and having good backups. When the ransoms are paid, we usually see that they're in the region of 115,000 USD, but this is generally commiserate with the size of the organization that's been affected. So if you're a larger organization, you can expect that number to be much higher. They generally go through information on a victim's network to find out things like revenue, profit, how much they're insured for, and then they set the ransom commensurate with that figure. Finally, some big points around the business email compromise attacks, protecting email accounts. Multi-factor authentication has certainly been a big topic for many years now. It is so critical. However, what I'd like to point out from this slide is we're seeing more and more instances of when organizations have multi-factor authentication. Maybe it's a code that you get on your phone, a token you have to enter before logging in. They have this protection, but it's not quite enough. So you need to go to the next step, the next level now, is what we're seeing. You need to go deeper and figure out what other controls you can implement to protect yourselves. And finally, from a BEC payment fraud redirection point of view, we've got some stats here, but it shows the kind of amounts that we see being sent to the threat actors' bank accounts as a result of these attacks. Some of these are over $250,000, $500,000. We've seen over $1 million before that have been signed off by executives who think it's legitimate, who say, yep, just pay the invoice, it's no problems. You need to have internal processes in place to address this, as well as those technical controls. So that brings us to the end of my presentation. Thank you very much for listening, and we'll move on to Toby.
Thanks, Jack. Good morning. Toby Hodgson, Senior Manager Digital Health at the Medical Technology Association of Australia, or MTAA. It's great to be part of the CHA National Conference. I'll start by briefly introducing MTAA and the medtech industry, then touch on some of the priority cyber-related issues, along with the work being undertaken in this area by members and groups. With the Peak National Association representing companies in the medical technology industry, established in 1981 with over 100 members that include manufacturers, importers, exporters, suppliers, distributors, of medical technologies. Last year, MTAA released the Value of MedTech report, which outlines the enormous values the industry provides to the economy, our healthcare system, and most importantly, to patients. The report shows that MedTech employs over 50,000 jobs when including those that support and supply the industry. MedTech also contributes significantly to the economy, providing a $5.4 billion total annual contribution to Australia's GDP. Initially physical device-oriented, MedTech, like everything else, has shifted digital, with more and more devices containing sensors, pumping out data that's used for clinical assessment, product development, and fueling innovation. From companion apps and software for physical devices, to software-only solutions, embedded artificial intelligence, and software as a medical device. Digital health is a key priority for MTAA, and we acknowledge the effects that cybersecurity has on healthcare industry, both domestically and internationally. Collaborative efforts between the public and private sectors, governments and consumers are all essential to secure Australia's valuable health data, maximising the benefits of digital health solutions, and most importantly, improving patient outcomes. The Department of Home Affairs Australian Cybersecurity Strategy calls for a new era of collaboration on cyber in Australia, producing a strategy that defines a clear vision for both domestic and international cybersecurity for the first time. Last year, through our Digital Health Advisory Group, we ran a digital health survey, and perhaps unsurprisingly to those here today, cybersecurity was the number 2 priority, with 78% of respondents indicating it was a key concern. Cybersecurity goes hand in hand with the top concern of health data, covering data governance, with the collection, retention, storage, management, sharing, and privacy of information. To make the best use of digital technologies, public confidence in the protection of health data needs to be high. We want every Australian to be confident that their personal health information is safe and secure. Confidence has been affected by recent well-publicised cyber breaches and events, including those already mentioned on the panel today. Although Australia's medical device regulatory framework is considered gold standard, healthcare remains behind other industries in terms of cyber practices. Healthcare can learn from industries like financial services with their willingness to invest and improve beyond what is mandated and their readiness to collaborate. Harmonisation with global best practice is a core goal. However, alignment nationally is potentially even more important. There are many jurisdictional differences in cyber requirements. Thankfully, there are numerous great organisations and associations, including Catholic Health Australia, working to improve Australian health cyber resilience, guidance from government bodies, including recommendations around the use of Australian Cybersecurity Centre's Essential 8. Some of the key recommendations from our report include that policy directives are put in place to apply uniform provisions to all players in the supply chain, that regulatory agencies and peak bodies across Australia promote efforts to enhance cybersecurity awareness through fundamental training programs available to both healthcare professionals and patients, that a different approach to communicating cybersecurity vulnerabilities in devices is considered, potentially seemingly ominous sounding recall may be required simply due to a change in the environment surrounding a device rather than a compromise of the device itself, and the development and implementation of a comprehensive cybersecurity strategy is essential. Let's look at some cyber statistics. According to a survey released earlier this year, cybersecurity is the #1 issue for Australian business leaders, with 43% of executives rating cybersecurity as their top issue. The pie chart on the left shows that nearly a quarter of all medical devices, including imaging, clinical and surgery devices, have at least one known exploited vulnerability. The bar graph in the middle shows that healthcare is in the top 5 cybersecurity incident reporting sectors. 14% of connected medical devices are running an unsupported or end-of-life operating system, the worst offenders being imaging and diagnostic workstations, PAC systems, medical data systems, and image converters. Surprisingly, 4% of devices used in surgeries are accessible via a hospital's guest network. Health data is also a strategic target for cybercrime and is one of the top information types exposed during a cyber breach. The average amount of data reported to have been taken during a breach is large, slightly conflicting with Jack's at 120 gigabytes, with the highest report being just under a terabyte. While these are all alarming statistics, and we're well aware of the recent breaches, care should be taken to avoid any overreaction that inhibit patient care. A good example of this is the decision of some hospitals to remove external data feeds to devices altogether. However, cutting off access to maintenance data on these machines also removes the ability for manufacturers to be proactive and identify and address potential problems before they affect clinical practice. The removal of these feeds may actually lead to potentially far riskier cyber practices, from the use of USB keys to move information around to unauthorised and temporary methods of connecting devices to the outside world. So what steps can we take to ensure that devices and systems are secure? Well, step one is to audit your data stores, know what data your organisation is storing and where, reduce exposure by ensuring that only essential data is stored in each individual system. This knowledge is essential for when an inevitable breach occurs. The last thing we want is to be in a position where additional public announcements need to be made that further elements of information may have been accessed, as we recently saw with some of the highly publicised breaches at Medibank and Optus. Understand what can be controlled and what the organisation is actually concerned about. What is a priority for an acute hospital may be very different to that of an aged care facility. Implement strategies to address risks such as secure by design, a proactive, security-focused, holistic approach. Consider cyber threats from the outset to ensure mitigations through design, architecture and security measures. Perform a cybersecurity risk assessment. Security by design's focus on damage potential directly aligns with the primary concern in healthcare of patient safety. There are several global standards available to comply with: ISO 27001, SOC 2, Canada's Cyber Resilience Standards for Healthcare, and regulatory compliance. Regulatory bodies like the FDA in the US and TGA locally require thorough cybersecurity assessments as part of their approvals process. As CHA is well aware, additional reporting requirements for the healthcare and medical sector have been introduced with the Security of Critical Infrastructure Act, or SOCI, with designated hospitals required to implement a critical infrastructure risk management program. While important, these obligations come at a cost that private and not-for-profit hospitals may not be able to meet. While manufacturers must assume responsibility for the security of their products and services, consumers also need to proactively educate themselves and understand the risks associated with acquiring and operating these solutions. And finally, take a whole-of-organisational approach. Engage with the workforce. We should try and make it fun, build a culture that embraces an ethos of cyber protection. In this regard, we want a culture of suspicion. AI is making the English in phishing attempts as good as native, so we can't rely on being able to easily spot dangerous emails. Involve the whole organisation from the CEO down, run training, simulations, and even gamify to encourage vigilance across staff. Cybersecurity is everyone's problem. We can't just continue the old assumption that IT will deal with it. So with industry, government, providers and consumers working together and taking a proactive and structured approach, we can lessen the likelihood and impact of cyber events. MTAA has several open digital health groups that focus on areas such as data standards, regulation, reimbursement, AI and privacy. While they are typically industry focused, we'd love to have additional healthcare providers' perspectives, so please consider joining and participating. Our next opportunity to continue this discussion will be at our own conference here in Sydney in October, bringing together leaders and influence to discuss the key areas affecting medtech with a strong focus on digital health and cybersecurity. I'd also encourage you to download a copy of our Breaking Barriers to Deliver Better Patient Outcomes report, as I've referred to throughout. MTAA would be more than happy to meet and discuss any of the digital health aspects I've touched on today. Please feel free to reach out to me at the details on screen. Thank you for your time. I'll now hand back to Catherine for questions.
Thank you. I do have a question for you, Jack. AI has been a really hot topic at the conference. What role does AI and machine learning play in threat detection?
Yeah, great question, Kath. It plays a role on both sides of the fence, from the criminal's perspective and also from the defending perspective. We've certainly seen AI's impact, if you think of it in basic terms like ChatGPT, right, on things like phishing emails, where previously it was quite easy to tell a phishing email because maybe there was some broken English and bad grammar in those emails. They've now been run through things like ChatGPT or other similar programs, such that they're now way more effective in convincing the user to download a bad file or enter their credentials into a dangerous place. On the other side of the fence, though, there are some good things happening from the defender's point of view with AI. A lot of protective technologies coming into play. Microsoft's a big player on that front with the capabilities they have to detect threats using AI, but also just to make the defender's processes faster, more efficient, do the triage of incidents and alerts for them, pick up information in an automated fashion that had to be done manually before, right? It becomes almost a big data problem and making it more efficient.
Yeah,
That's
cool.
what I'd say.
I think we had it. There it is.
Hi, C.T. Johnson from Catholic Healthcare. The question is for Elliot. You were talking about that your crisis management group or your executive leadership team established a standard for when you would go out and tell everyone else. Could you talk a little bit more about that, and what was that standard and what made you decide to go out to the wider world?
So effectively, they were all to do with understanding the nature of what we were dealing with. So all we knew on the night of the 19th was that there was a threat actor on the network. That is, and you know, if you talk to technical people, that is not an uncommon occurrence to detect effectively that there's somebody in your house walking around. What ordinarily would happen in a cyber incident is you would learn about a breach by virtue of being told about a breach, because something's been posted on the dark web, the threat actor has made contact and tried to ransom you. We were in this weird position of having worked out something was going on before knew there was something going on. So some of the thresholds that we had of when we would want to go public were all around, could we ascertain definitively that any data had been stolen, no matter what size it was? Had we been contacted by the threat actor? Had there been any information posted on the dark web, or was there any operational impact to what we were doing? Now that's 4 out of 5, so I think I'm pretty close, that'll do. But they were the nature of the sort of thresholds. Where we got to on the evening, very, very late on the evening of the 20th, was establishing that a packet of data had gone out the door. We knew the volume. At that stage it was 1 or 2 gig. We didn't know what was in it, but that for us was enough to trigger. We had an obligation using our values. That was enough to go and inform our people, our residents, our patients, and the public.
Next question.
Philippa McDonald, freelance journalist, MC at this wonderful conference. What does a culture of suspicion look like? Who wants to take it? Or maybe all of you might want to have a crack.
Trying to be vigilant, trying to assume the worst, if you like. So when you see something that potentially could be a threat, that you immediately assume that it might be bad, rather than, it's from an email address I've recognised or a name I know. It's sort of trying, is that the sort of thing that I'm expecting to be asked for from that person? Is there anything that sort of raises any red flags? I think that sort of vigilance is really required. You can't just assume that it's going to be picked up by IT, or it wouldn't get to me if it hadn't been verified, because it will be affecting everyone.
I think it also looks like education, though. Making sure that everyone in the organisation is aware of the kind of things that can happen as a result of a cyber attack, and that they're on board with trying to help the organisation recognise and identify these things. But it also means if you're in the position, or you have someone in the position of having made a mistake in this area, right, you help them through it and you help them learn. You don't kind of target them and punish them and point them out and say, you did something really bad here. You say, okay, we need to recognise why this happened, and then make sure that everyone understands what to do so that it doesn't happen again, right?
We're in the trust business, so.
I think there was a question over there.
Yeah, thank you. Chris Townend, Marta in Queensland. It's a question for Elliot. I was just interested, and it sounds like you dodged a bullet, which is great, but just interested in whether at a governance level your board had already set a policy position on ransomware, because, if it got worse, or if it had been a really serious issue, when you're up to your neck in alligators is not the time to start having theological and philosophical discussions. So I just wondered if you'd already had a position set.
Yeah, so there's obviously there's some things that I don't sort of talk about in these sort of forums, but I think Jack or Toby mentioned it before around constant training and dry runs and practices of these sort of incidents. Our board had put itself through that process some 12 months earlier, and had thought through in detail quite a lot of those questions previously, and had been quite thoughtful about those. So it there was a deep familiarity and language within the board already around what sort of questions it would likely have to confront and at least knew that what the questions were going to be and had started to think those through. In terms of during the response itself, our chair set up a dedicated crisis subcommittee of the board, which had had about 4 separate working groups. One of them was thinking about the questions coming at it, not the questions currently at it, including some of those thornier legal questions as well.
Any other questions? Oh, over there.
Thanks very much, Joel Hodge from ACU. Just interested in the point that you made about the multi-factor authentication, that's failing in so many, almost two-fifths. What other preventative controls you mentioned, Jack, that there were some other things you could do. What kind of things do you recommend apart from MFA?
Yeah, so to elaborate on that one a bit further, the reason we see it failing is because of an attack that we call session token theft. So it's where someone has already basically logged in, but an attacker gets access to their computer and they're able to basically steal that session. There's a lot of good controls that you can unlock within Microsoft as an example. Many organizations use the Microsoft suite, Microsoft 365 or Office 365. And some really key controls we see in that space are things like conditional access. So conditional access will allow you to set additional policies that basically say, for example, if someone's trying to log in from a country that's not Australia, this is suspicious, so perhaps prevent that login from happening. Or maybe it's an unknown device that they're logging in from, an unknown browser. It uses a whole lot of these different metrics to determine what suspicious looks like. And you can tune those to your preference depending on how your business operates so that it doesn't prevent people from doing their jobs as well. That's probably the best example I can think of.
Well, I'm going to ask another one, and I'm going to pick on Jack again. A lot of the organisations in this room are small and resource limited. So how can these organisations implement robust cybersecurity measures without incurring significant cost?
Yeah, really great question, and something that a lot of businesses we see struggle with, right? Because hiring an internal team to address cybersecurity is expensive. Hiring external consultants can often be expensive too. You really have to prioritise well. And so what we generally recommend for early activity is doing something like a high-level enterprise risk assessment to understand as an organisation where you're at currently and what your primary requirements are, what the most important things are. From there, you can build a roadmap, basically. You can say, okay, we're going to address these most important things first and we'll get the most value out of those things for the least price. And then we can worry about those much harder, perhaps more expensive things down the track for the roadmap. It's the best way to approach it. But simple measures such as multi-factor authentication, right? There's a list of easy things that most IT people will be able to implement to really protect your organisation from the really bad attacks as well. Those are easily, quite easy to find online a lot of the time.
Any other questions?
Thank you. My name's Tim Johnston. Elliot, you talked a lot about trust frameworks and reputational risk. You had an attack on the 19th of December. You went public on the 20th, 21st. Presumably for your patients, they were worried for a month that their data was floating around on the dark web. That has a huge reputational risk in itself. I mean, if you delayed it by 2 or 3 weeks, you wouldn't have worried them at all. Mm. That must have been a tough decision.
Yeah, so I'm glad you've asked that because it gave me a chance to add something, a couple of things I didn't get a chance to cover. So our CEO and our board had the strong view that reputations get measured in hindsight, not in the moment. And that particularly in a cyber incident, but it could occur really in any crisis and anything involving potentially sensitive patient data, is that the very first question about someone, the very first question that will get asked of you whenever information becomes public is, when did you know, what did you do? And if we had waited until we knew exactly what had been exfiltrated and the nature of it, say we waited until the 25th of January and we got that bet wrong, and it turned out that it wasn't 5 gig of configuration data, it was 5 gig of the most sensitive patient data possible, and we had actually found out about that as early as the 19th of December, and we had chosen to not say that we were investigating something that could have affected someone, the long-term systemic damage that would have done to us as an organisation, I think, would be severe. And I think there's some quite high-profile public examples of other organisations who have made that bet and come to a different conclusion. So we felt that our reputation we measured in hindsight. In terms of what the next part of that is, so we decided to go public on the 21st. There is then a huge appetite particularly from aged care residents on what the nature of the data theft was and what the nature of their data was within that. And that kind of makes sense. You've got a very different relationship with your aged care residents than you do with a patient in emergency on a short interaction, for example. Like our aged care residents quite literally live with us. They have a very direct financial connection point with us and are in a demographic that is more susceptible and more anxious about some of these questions than at the other end of the demographic scale. So the question that we then had to ask ourselves is, even when there was nothing to say other than something happened we're investigating, is how often we had to go in and check in with that. The method that we used was one of listening to our front line. So we've got some incredible, and you've heard some of them already on previous panels, incredible frontline leaders within our organisation who are highly attuned to their patients and to their residents. And effectively, because we're not ASX listed, there was no additional reporting requirements. All of our choices to update was based on ourselves. We basically, whenever our frontline told us that the people that they were talking to every day, their patients, residents and staff, were feeling like they hadn't heard from us from a little while, was when we put out an update and when we'd communicate. So we had a pretty tight feedback loop internally to make those assertions, because the reality was nothing really happened between the 21st of December and the 25th of January, but we would have communicated at least on 5 separate occasions quite strongly, internally and externally, letting people know what was going on. But overall, our assessment was that our reputation in the long term will be better served by us being more transparent and more honest, even when that meant a harder short-term hit.
Well, that brings us to time. Please join me in thanking our panel.